Good morning, everybody. It's Dr. Toker, your friendly neighborhood colorectal surgeon. And many of you who know me or follow me know that last week I was invited to give a speech in Orlando. Or if you didn't know, I'm telling you, okay, I went to Orlando last week. And I was asked to give a speech to a company called Super Patch. And I've recently just sort of met them, the owner of the company and the CEO and the engineer who designed this particular medical device. And I've used it in my own life to positive effect. And so I really do think it serves an important function in the treatment of patients. Now, how quickly can you get someone to welcome this technology into their practice? That is for every physician to decide. But anyway, this company has been in business for quite some time. It's just been quite small, and they're trying to expand. And so one of the reasons to invite me as a medical doctor is because they would like to see physicians reach for this non-medicated technology as opposed to a prescription pad, because prescriptions really do come with a lot of complications. They're extraordinarily expensive. And then if you have to be on a medication for a prolonged period of time, the side effects of those medicines lead you to need other medicines. Is what we call polypharmacy. And if you're a doctor my age or older, I suspect a few years younger than me, but anyway, and I've been a doctor for almost 30 years now. And we were trained in medical school to not reach for the medicine for the fear of polypharmacy, especially in the older population. And so in my practice, I still cling to that concept. Now, I know the younger doctors, they may not even be taught this. I don't know if they're even taught this, to be frank with you. The modern world of medicine is not really geared for the person-to-person interaction that drove most of us into medicine in the first place. And there's not a lot of time to talk to people. You certainly don't have enough time to explain complex technology, which this patch kind of falls into complex technology. Simple to use, but difficult to explain. So I've kind of taken it upon myself in my practice. So if you're my patient, you'll hopefully see this video. But to this new company that is trying to expand, they have a lot of sales representatives. And even to these sales representatives, the way this device can work can be a little bit, I don't want to say magical, but it seems magical. And I think in terms of, imagine if you were the first person to witness a light being turned on. I mean, can you imagine living in a world of candles and lamps, and then someone sets up a room, hits a switch, and the light goes on? What magic would that have been like? In my life as a surgeon, there have been several revolutionary approaches to surgery that were initially not well accepted because they were seen as, magical. It's like that's too weird to deploy in the care of patients. So as a surgeon, that would be laparoscopic surgery. When laparoscopic surgery first came out, the doctors who were performing it initially they were French. It's one of those things. French gave us wine and cheese, and they gave us laparoscopy. How? They're so laissez-faire. But anyway, it was a brilliant, brilliant concept. Why make a big incision? If I've got a TV camera and a couple small instruments, why can't I just try to do it that way? And that was seen as almost irresponsible. In fact, when I was in my residency training, there were certain cases you would never, ever, ever do that way. Like an appendectomy. You would never do an appendectomy that way. Are you kidding? That's like heresy. So would removing someone's colon like that, or a segment of their liver, or cancer, or a uterus. Like, you would never do those things. Didn't even make any sense. The gallbladder was the only thing at that time that kind of made sense because the gallbladder is a collapsible thing. It comes out through a hole just as big as the port. Well, so does an appendix. But anyway, it took a long time before laparoscopic surgery became sort of the standard of care. And then enter robotics. Initially, it was verboten to use robotics for colon surgery. They had to have this huge, especially in cancer, there was an enormous study that was going on. I trained at one of the few places in America that had a robot, and it was pretty much deemed not for us. That was supposed to be for urologists only, because it can only focus on one part of the body. It's too clunky to move around the abdomen, colon surgery, and you had to be everywhere. And so we got to play on the device, but we did not get to operate on patients with a robot. Well, everything I do now is with a robot. I specialize in robotic surgery. So, and I tell this story because I feel like this technology kind of falls into this same frame of thinking where it is so simple to the patient. The science is rather complex and how it works is so complex, but the safety profile and the simplicity to the patient makes it such that it really should be the first place people go. Okay, so I say all these things because since I gave my talk last week, and the speech was on, I was asked to present the concept of homeostasis, because that is how these devices work. They return the body to homeostasis. So a lot of people don't know what that word means. And so, you know, Dr. Anna, can you put that into terms that the regular guy on the street could understand? And as soon as that speech is available, I'll share it to my social media and my website and stuff. And then I was asked to re-give that speech in a longer format tomorrow night, actually. And that, I think, is going to be recorded. And if I'm allowed a copy of that, Terry St. Amand, I know you're listening. If you'll allow me a copy of that so I can share that to disseminate to the people, I'd appreciate it. I do not get paid for any of these speeches, by the way, just in case you were wondering. I have no paid interest, not yet, anyway. I mean, one day maybe I will be asked to do something for an income, but right now this is me fascinated by science and thinking my patients would benefit from it in the same way that I have. Okay, so my thoughts is, since that speech, I've had several of these sales representatives reach out to me and say, Dr. Anna, like, explain to me this again, or explain to me that again, or I'm getting ready to talk to a doctor and ask them how to use it in their practice, and they really won't give me the time of day because I am not a doctor and I need to use better verbiage with these doctors. So this video is for you. And I've not asked permission from the CEO of Superpatch if I could post this video, but I believe he would give me the approval since he's already asked me to speak on this topic in a public forum anyway. So Jay, forgive me. And I'll take this video down if he wants me to, but I don't think he will. Okay, so what am I talking about? The technology that I'm speaking of is something called a Superpatch. If you want to see the website, I will give you my website, which is haptex, HAPTEX.superpatch.com. That's just the website that has my face on it that goes to Superpatch. Okay. If you look, and that's a well done website actually, because they will include in it all the scientific studies that are germane to the general population in regards to how the technology works. But then there's another video, well done, by the way. So if you follow Brinks.tv, and you should, the guy who started that online streaming service, his name is John Brinkus, and I had the pleasure of meeting him last week. What a fun person to hang out with. But he put together an amazing video on the science of Superpatch, and it is on YouTube. And so look that up, The Science of Super Patch, because I think you'll like it. He well done, actually. And he talks about the actual technology, and I'm going to talk about sort of the biologic science, so to speak, as opposed to the physics. So anyways, the concept is basically this. Everything in biology is trying to achieve perpetual balance. And we call that perpetual balance homeostasis, right? The basic concept of homeostasis is the more things change, the more they stay the same. And the easiest way for you to understand that is the thermostat in your house is set at a temperature. And so when it gets above that temperature, the air conditioner kicks in to cool it down. And if it gets colder than that temperature, the heater kicks in to warm it up. So it really doesn't matter how many people are in a room, how hot it is outside, or anything like that. In the system, when the thermostat is on, the temperature remains reasonably the same. Now, you can overwhelm that system very easily, but for the most part, with the exception of extreme stressors, stays the same, right? This is a concept we all know in the modern world, which is why I use it. So that is homeostasis. Now, each cell in your body is trying to achieve homeostasis with its environment, and they can do so passively over gradients or actively expending energy to get things from the external environment inside, like sugar, or to block things from the external environment, such as certain amounts of sodium. Okay, so that you've got these little ways in which a cell can maintain its own little compartmentalized life. But that cell cannot live alone. It has to live with its neighbors. So it has little communication means by which it communicates to other cells that are like it within an organ. So now that organ can function as a unit. And then, of course, that organ doesn't live in a vacuum either. It's living inside your body. So that organ will talk to other organs, and they will function as a unit. And the way God has made our bodies, it starts with the head. Our brain glues all of these systems together to make sure they're all functioning in homeostasis. Okay? The second the brain goes, you can maintain very baseline homeostasis. So a brain dead person will have a heart rate, a blood pressure, a temperature, but it takes very little for the wheels to fall off in that scenario because the brain is not there to coordinate. Okay, so your brain is actually important. We think of our brain as being thoughts and memories and mental illness and those kind of things, and we don't think of that brain as being directly responsible for the coordination of the rest of our body. The other aspect that we don't really consider is the microbiome, which are the GI tract bacteria that make the neurotransmitters that your brain uses to communicate with the rest of the body. So there is a gut-brain axis that is critical to biologic life in mammalian systems, and I suspect in reptilian, but I'm not a veterinarian, so I don't know, but I do know in humans, critical. Life is critical, requires the brain, the microbiome in your gut. Those things have to be functioning properly, or you yourself will not function properly. In the modern era, you've heard me talk for the last 2 years, very long-windedly, I know, that modern life is destroying the microbiome, and because the microbiome is being destroyed, it throws off the brain, and when the brain doesn't have the proper signals and neurotransmitters, the rest of your body suffers. And so that most modern disease is coming from damage to the microbiome as well as our brains. Okay. Yeah, back up. Technology. Oh my God, Toker, get online. Okay, this technology uses a very specific concept that we all are aware of, and that is our skin has sensory input to our brains, which is why we know when we touch something hot, we withdraw our fingers. It happens instantly. before you can even say, ouch, your body has felt the heat and removed it to limit the damage. Okay, our skin has this capability. Okay. So if negative signals can go from the skin to your brain and create a reaction and a feedback loop, then positive signals can go from your skin to your brain to calm things back to baseline. Okay? These patches contain a very specific pattern, and there's a lot of different pathways to the brain, one for sleep, one for pain control, one for anxiety, one for your metabolism, one for your balance, one for your immune system and your vascular control. And so the brain has a lot of these different pathways. And so based on Nobel Prize winning science, an engineer has figured out how to use that science with a practical application in a 2-inch by 2-inch Band-Aid that has little ridges on it. You cannot feel this Band-Aid when it hits your skin. It doesn't hurt. It's not like it's got needles or anything in it. There's no medicine in it. Anyone can use it. If you are human, if you are human, you can use this to positive effect. It can be used in children or infants or old people, pregnant people, lactating people, no matter what medicine you're on, no matter what your issues are, there's no contraindication to placing a patch on a person, okay? The way it works is each individual patch, depending on what pathway it's signaling, sends, for lack of better words, a QR code or a computer code or a Wi-Fi signal. I don't know what you want to consider it, but sends a signal from your skin to your brain to return to baseline homeostasis, no matter how out of whack it is. This is not a curative device. It's not even a treatment device. What are we treating? All we're doing is setting you back into homeostasis. And if your brain can settle down into homeostasis, it allows the organ systems to do the same. So just like a Band-Aid does not cause your skin to heal, it doesn't. It just protects the wound and allows your body to heal itself. This is kind of a mental Band-Aid. It's not going to cure anything. It doesn't allow you to heal. It personally is not healing anything. But it protects that pathway by keeping it in line and allows your body, if it's capable of healing, to proceed to that end goal. Okay, so in other words, if you have anxiety and you put on one of these peace patches, it doesn't take long before you realize you're really not anxious anymore. Now, take off the patch, your anxiety returns. This is why this is not a cure. But for the time that is on your body, your brain signal that says craziness and anxiety calms down. You don't need that. You're not being chased by a dinosaur right now. You can calm down. It's okay. The Viking hordes are not after you. And sure enough, you kind of do calm down. It helps you regain your own faculties, for lack of better words. I don't know if I've explained that properly, but that's the whole point of this video. So, Super Patch, I think it's valuable in the medical world as the first place to go. Diet, nutrition. This is in the physical therapy category, believe it or not. It's physical therapy before we reach for medications and surgeries. There are still a ton of people who are going to need medicines and surgeries. I mean, this is not going to 100% remove those things, but it certainly could be the one thing that keeps you from needing a medicine, right? So if you're a type 2 diabetic, you could change your diet and maybe never need diabetic medications. So if you're anxious, you can do meditation and stretching and infrared sauna and a peace patch, and you may not ever need medications for the anxiety. That would be the whole hope. I know personally the pain patch and me, it's fixed 90% of the pain that I was complaining of and has allowed me to start exercising again, which is invaluable. Did it remove 100% of the pain? No. If I take the patch off, does it hurt? Yeah. Didn't cure anything. But I can wear it when I'm exercising and exercise. Whereas before, I was just hurting. Nothing would make that pain worse. And I sat on the couch and the pain got worse and worse because I wasn't moving. Right? So that is how I have found it in my own personal life. I would like to use the pain function, the stress function, the balance function, and then the immunity function in my own patients to improve their recovery after surgery. So if you're interested in that concept, follow me. I mean, you know, I am happy to give speeches on this particular topic because I find it fascinating. All right. Very long-winded. I hope y'all don't mind. But anyway, have a good Sunday. And I will post videos as soon as I can.